Hey, this is not so complicated, presenting you on 5 minutes 5 high yield drugs. This is episode 5 of the series, presenting on neurological drugs like phenytoin, levodopa, sumatriptan, gabapentin, and donepezil. So let's begin without further delay. The first drug we have is phenytoin. It belongs to class anticonvulsant, which is also a sodium channel blocker. The uses of this drug are in tonic-clonic seizures, status epilepticus, that is severe form, and epileptic emergency case, and also in focal seizures. The mechanism of action is that it blocks voltage-gated sodium channels, thus stabilizing neuronal membranes and preventing seizure spread. The side effects of phenytoin are very large spectrum. The gingival hyperplasia, hirsutism, that is increased in hair growth rate of in entire body, Stevens-Johnson syndrome, that is adverse drug reaction, and cytochrome P450 induction teratogenicity, that is if taken by a pregnant female, it can cause fetal head and toe syndrome, right? So the USMLE poll for this drug is that it is a zero order kinetics. It follows zero order kinetics, and we have to monitor levels, that is 10 to 20 microgram per milliliter. We also have to avoid this drug in absence seizures, right? So the example case is a 30-year-old with tonic-clonic seizures starts phenytoin with dental checks for gingival hyperplasia. So the other drug that we have is levodopa. It belongs to dopamine precursor class, and the uses is Parkinson's disease and Parkinsonism. Parkinson's disease and Parkinsonism are quite different because Parkinsonism presents with a spectrum of disorders like tardive dyskinesia, muscle dystonia kind of things. So the mechanism of action of this drug is that it crosses blood-brain barrier and then it converts to dopamine, restoring nigrostriatal function, which is actually degraded in the case of Parkinson's, right? So we have to give levodopa with carbidopa so that it blocks peripheral conversion and also reduces side effects, right? So this is a very high rational USMLE poll 2, and the side effects of this drug is dyskinesia, on and off phenomena, nausea, orthostatic hypertension, and then psychosis. The USMLE poll is carbidopa mandatory to minimize peripheral effects, and it is contraindicated with non-selective MAOIs. You have to, this is your homework, you can comment down what is this drug, right, and why it is contraindicated. The example case is that a 65-year-old with Parkinson's tremor starts levodopa carbidopa titrated to reduce dyskinesias, right? So the other drug we have is sumatriptan. It belongs to 5-HT1B, 1D receptor agonist, that is in trypton. The uses are acute migraine with or without aura, and also in cluster headaches. The mechanism of action is that it activates serotonin receptors, causing vasoconstriction of cranial vessels and also inhibiting trigeminal nerve pain signals, right? The side effects of this drug is that chest tightness, coronary vasospasm, tingling, serotonin syndrome like SSRIs, right? So the USMLE poll is that it is contraindicated in CAD, that is coronary artery disease. Why it is contraindicated? Because this drug causes vasoconstriction, right? So that is why it is contraindicated. And also in uncontrolled hypertension, we have to use within 24 hours of onset. And the example case is that a 40-year-old with migraine and photophobia, that is fear of light, that is you cannot look into the light, uses sumatriptan for rapid relief, right? So the other drug we have is gabapentin. It belongs to GABA analog, anticonvulsant, and also analgesic. The uses are focal seizures, neuropathic pain, and post-herpetic neuralgia, and also fibromyalgia. The mechanism of action is that it binds alpha-2 delta subunit of calcium channels and thus reducing excitatory neurotransmitter release. The side effects are sedation, obviously, and dizziness, ataxia, and also peripheral edema. The USMLE poll for this drug is that we have to use adjunct for seizures, and also first line for neuropathic pain like trigeminal neuralgia also, and also we have to adjust dose in renal impairment. The example cases are diabetic with neuropathic foot pain starts gabapentin titrated to minimize sedation, right? The last drug we have is donepezil. It belongs to acetylcholinesterase inhibitor, and the uses are Alzheimer's disease mild to moderate, and also in dementia with Lewy bodies. The mechanism of action is that it inhibits acetylcholinesterase that actually breaks down acetylcholine, right? So if this enzyme is inhibited, then acetylcholine is increased in CNS, improving cognition. So the side effects are So the side effects are nausea, diarrhea, bradycardia, insomnia, and then seizures, which are rare. The USMLE poll for this drug is that it enhances cognition but doesn't halt progression, and also we have to avoid it in sick sinus syndrome. The example case is a 70-year-old with Alzheimer's memory loss starts donepezil to boost cognitive function. So that is all for today. Subscribe for daily doses like this. Thank you for staying with me. Thank you.